Hey everyone, welcome to another video with the Beacon team. It's a beautiful day, the sun is shining, the birds are singing, the government continues to roll back stupid regulations, and I am joined by our fearless leader, Justin Owen. Justin, how's it going?
It's going well. Thanks for checking in and giving me the opportunity to rant a little bit.
Yeah, I love ranting. Justin sent me a blog post that is live on our blog right now that I loved so much because the concentration of it was basically bashing the government and asking the question that we all want to know. If they're rolling back regulations in a crisis, things like alcohol delivery, certificate of need things, allowing doctors to practice across borders, increasing the scope of practice for medical professionals, if we can roll them back during a crisis, why are they here right now? Justin, what are some of the most egregious regulations that have been rolled back that you think need to stay there?
Well, not only do we need to roll these things back, we have to, right? Things like restrictions on telehealth have literally prevented people from getting access to care through this crisis. Relaxing those regulations has significantly expanded the ability of not only of patients who have the virus to get treatment, but other people who couldn't otherwise get in to see their doctor safely. And so that one's been a very important one. Rolling back certificate of need law so that hospitals have the bed space in order to deal with the influx has been important. As you mentioned, allowing more medical professions to come into the state and serve our people in the state that would otherwise take months and months potentially to get approval to get their license here. Other people, nurses to serve patients, nurse practitioners, others. I mean, the list goes on of examples of we had to get rid of these regulations, otherwise we could not effectively provide health care to people. And so begs the question, why do those restrictions exist in the first place? And what would happen if we lifted them permanently and said, you know what, we're going to provide access to health care across the board in good times and bad. And so those are the types of things that we're going to be pushing on the healthcare side. You mentioned some of the economic regulations that, again, are either protectionist in nature or don't have anything to do with public health and safety. And as we look at those things that have been suspended, and kudos to our governor for suspending a lot of them, more than most states, but we shouldn't just suspend them, we should make them permanent. Because if we can't have those things in bad times, we don't need them in good times.
I completely agree with that. I mean, if there's ever a time to come together, it's during a crisis. And I think that we're seeing a lot of people starting to realize maybe things are a little things that they said, well, what would happen if we didn't have this? Now we
Now
don't
we
know.
know.
And things are going pretty well, I would say. I mean, in the midst of a crisis, people are coming together and having the opportunity to actually do something to help because the government's getting out of the way.
When the government allows them, right? I mean, unfortunately, there are some states where they're taking the opposite approach, where they're going full-blown lockdown on citizens and businesses, making every business close, even though many of those businesses are offering great services. You've got distilleries producing hand sanitizer, and you've got GM and Nissan and other, I think Nissan, a lot of the auto manufacturers making ventilators. And so, we have to strike a balance. Of course, we have to protect public health and safety. And you and I are home, working from home, because we don't need to be out. And I went to Walgreens once this week. I've almost forgotten how to drive because I've just been stuck at home so much. I drive like a maniac when I'm going down the road now. So for those of us who can be home and do our part, we have the personal responsibility to do so. But even as our governor said, I'm not doing a mandatory lockdown because A, it's not enforceable. B, looking at states like New York and California, it hasn't necessarily worked. And in some cases, it's caused more harm than good. And then we need to make sure that those businesses that can help provide solutions to this problem and help get us out of it can continue to stay open, and that the businesses who can maintain those CDC guidelines, 10 or fewer people on the premises and that kind of thing, let them continue to provide jobs to their employees and provide their goods or services, because if we shut them down unnecessarily, many of them will never come back. And that economic harm long term doesn't have to be something that we give up if we have reasonable and thoughtful solutions. And I think Tennessee has among all the states, done probably the best, if not among the, is at the top in terms of doing the best job of trying to strike that important balance.
Yeah, it doesn't have to be one or the other. It can be both. If you want to hear more about what Justin has to say, his post is live on our blog right now, and we're going to be continuing to talk about this, highlighting regulations that need to stay gone. They need to get gone. They need to stay gone in order to help, public health and safety, but also our economy as we start to rebuild after this. Justin, thanks so much for taking the time to talk to me.
Wash those hands.
Wash those hands, Steve. We'll talk to you soon.